Imagine you've just fed your dog their favorite meal. Shortly afterward, they begin to show signs of discomfort. Restlessness, excessive drooling, failed attempts to vomit. You might think it's something minor, but in reality, your dog could be racing against time due to a serious and life-threatening condition, gastric torsion. This condition can affect any dog, but some breeds are more prone to it. In this video, we'll explain everything about this veterinary emergency, from risk factors, symptoms, and treatment to prevention tips that could save your pet's life. Gastric torsion, or Gastric Dilatation-Volvulus, GDV, is an extremely serious and potentially fatal condition. It happens when a dog's stomach fills with gas, fluid, and food, causing it to rapidly expand. As it bloats, the stomach can twist on itself, cutting off blood flow and trapping the gases inside. If not treated quickly, this condition can cause internal organ necrosis and lead to death within just a few hours. That's why gastric torsion is considered one of the most critical emergencies in veterinary medicine. Although any dog can suffer from GDV, some breeds are more predisposed due to their body shape and anatomical structure. Large, deep-chested breeds are at the highest risk. These include Great Dane, Saint Bernard, Weimaraner, German Shepherd, Labrador Retriever, Golden Retriever, Rottweiler, Doberman, and Boxer. If your dog is one of these breeds, take extra precautions and be alert to the signs we're about to explain. Symptoms can appear suddenly and progress quickly. Some warning signs include a bloated and hard abdomen, unsuccessful attempts to vomit, excessive drooling, restlessness or agitation, rapid breathing, weakness and lethargy, pale gums, and sudden collapse. If your dog shows any of these symptoms, seek emergency veterinary care immediately. Every minute counts. Several factors can contribute to gastric torsion, including eating large meals all at once, intense physical activity right after meals, drinking large amounts of water too quickly, genetic predisposition, advanced age, and stress and anxiety. Avoiding these situations can significantly reduce the risk of the condition. If left untreated, gastric torsion can cause death within hours. The lack of blood flow to the stomach and surrounding organs can lead to tissue, resulting in systemic failure. Studies show that the mortality rate can exceed 30% even with intensive treatment. Without medical intervention, the chances of survival are almost zero. Treatment for gastric torsion must be performed exclusively by a veterinarian. The main steps include administering intravenous fluids to stabilize the dog, decompressing the stomach using a tube or needle, and surgery to reposition the stomach and prevent future twists. The surgery not only repositions the stomach but often includes a procedure called gastropexy, where the stomach is attached to. Gastric torsion is a medical emergency that requires immediate veterinary attention. Any delay can be fatal. The best way to protect your dog is through preventive measures, such as dividing their daily food into smaller portions, avoiding intense physical activity right after meals, providing water in moderate and frequent amounts, reducing stress and anxiety, considering preventive gastropexy in high-risk dogs. Let me share an incredible story of canine loyalty. Once, a Labrador named Max began showing signs of gastric torsion in the middle of the night. His owner, Pedro, didn't realize the danger right away, but his other dog, a German Shepherd named Thor, began barking frantically to wake him up. Pedro finally understood something was wrong and rushed Max to the vet clinic. Thanks to Thor's persistence and Pedro's quick action, Max underwent emergency surgery and survived. This story reminds us that dogs don't just rely on us, they protect us in unexpected ways too. Gastric torsion is a silent enemy, but with the right information and preventive care, you can keep your best friend safe. Stay alert to the signs, reduce risk factors, and seek veterinary help immediately if you suspect this condition. If you found this content helpful, leave a like, subscribe to the channel, and share it to help more pet owners protect their dogs. See you in the next video.